4 pathways, 1 neurotransmitter, and countless paper A questions. If dopamine pathways confuse you, meso, negro, tubero, what exactly goes where? In the next few minutes, you will master all 4 dopamine pathways and never mix them up again. Let's understand why the dopamine pathways matter. The dopamine pathways explain psychosis, antipsychotic side effects, Parkinsonian symptoms, hyperprolactinemia, negative symptoms, and that makes this a favorite in psychiatry and neuroscience. There are 4 major dopamine pathways: mesolimbic, mesocortical, nigrostriatal, and tuberoinfundibular. Remember, my mind needs training. MMNT. M for mesolimbic, M for mesocortical, N for nigrostriatal, and T for tuberoinfundibular. So let's understand the first pathway, mesolimbic pathway. This pathway runs from the ventral tegmental area to the nucleus accumbens, and this is the brain's reward pathway. It influences pleasure, motivation, reinforcement, and salience. When dopamine is too high here in this pathway, positive psychotic symptoms can emerge, like hallucinations, delusions, and thought disorder. Understand that hyperdopaminergia in the mesolimbic pathway is linked to schizophrenia positive symptoms. Antipsychotics work partly by blocking dopamine here, and thus they reduce the positive symptoms. The second pathway is the mesocortical pathway. This pathway runs from the ventral tegmental area to the prefrontal cortex, and this pathway controls attention, planning, executive function, and emotional regulation. When dopamine is too low here, you may see apathy, reduced motivation, poor concentration, and flattened affect. Remember, these are negative symptoms. So, hypodopaminergia in the mesocortical pathway is associated with negative and cognitive symptoms of schizophrenia. So, let me give you a memory tip. Mesolimbic, more dopamine, more psychosis. Mesocortical, missing dopamine, missing motivation. The third pathway is the nigrostriatal pathway, and this pathway runs from the substantia nigra to the striatum. As the name suggests, nigrostriatal. The pathway controls movement. Remember, it is the movement pathway. So, when dopamine is blocked here in this pathway, patients may develop tremor, rigidity, bradykinesia, acute dystonia, and akathisia. And these are extrapyramidal side effects, which are commonly seen with antipsychotics. Also remember, if a degeneration happens in this pathway, it causes Parkinson's disease. Remember, negro equated with black. Nigra means black. Think black substance, body movement. Pathway number 4 is tuberoinfundibular. It is associated with prolactin control. This pathway runs from the hypothalamus to the pituitary gland. Dopamine here normally inhibits prolactin release. Dopamine If dopamine is blocked in this pathway, so prolactin will rise because dopamine normally inhibits the prolactin release. If you're going to block dopamine, consequently, prolactin will rise. So the clinical consequences of a dopamine blockade in this pathway would be galactorrhea, amenorrhea, sexual dysfunction, reduced libido, infertility, and gynecomastia. It is especially relevant with certain antipsychotics. Let's quickly compare these pathways now. So, the mesolimbic pathway, it is associated with reward. An increased dopamine in mesolimbic pathway is associated with positive psychotic symptoms. Mesocortical pathway, the function is cognition, and a hypodopaminergia, low dopamine or missing dopamine, is associated with negative symptoms. Nigrostriatal pathway, which runs from substantia nigra to the striatum, this is known as the movement pathway, and a low dopamine in this pathway is the reason for extrapyramidal symptoms or Parkinson's disease. Tubero-infundibular pathway is essential for prolactin control. So, if a dopamine blockade happens here, that will increase prolactin, causing symptoms of hyperprolactinemia. Now let's try to answer these questions. Which dopamine pathway is associated with antipsychotic-induced hyperprolactinemia? What is that? That is tubero-infundibular pathway. The second question, positive symptoms of schizophrenia are associated with increased dopamine in which pathway? The answer is mesolimbic pathway. Let me give you a last-minute memory hack. Limbic is equal to lunacy, that is positive psychotic symptoms. Cortical means cognition, negative symptoms. Striatal equated with the steps, that is the movement. And tubero, you can equate it with testosterone or hormones in general, and that is prolactin. Master these 4 pathways and you will answer not just neurobiology questions, but also pharmacology and side effect questions as well. And together, these form high-yield paper A revision questions. So thank you and stay tuned for further videos on this channel.